Welcome everyone, dear audience and dear chair. My PhD topic is about the fixation techniques used in the therapy of jaw fractures. I'm Petra Papucci and I'm an oral surgeon at Department of Oromaxillofacial Surgery and Stomatology. My supervisor is Zsolt Németh and my SMS is Kata Kelemen. My vision is to learning and utilizing the latest techniques in case of jaw fractures, and my mission is to use a faster and more comfortable method for sprinting in the night duties. You can see here my specific goals are to investigate the effectiveness and safety of the currently used methods in treatments of jaw fractures. And my second topic is going to be the maxillofacial injuries related to the e-scooter usage. My first topic is going to be a network meta-analysis. In case of jaw fractures, which involves the dental occlusion, we have to use the IMF, it's the intermaxillary fixation, and the MMF, the mandibulomaxillar fixation, is the same word. Because the mandibular fractures are the second most frequent facial fractures, they are more common in males in their 20s. We have to fix the fractured ends, because if we don't do that, there could be a bite and functional differences, and besides that differences, it could be an inflammation which can cause, for example, sepsis or necrosis or anything like that, like you can see on the picture. So we can fix the fractured ends in two ways. The conservative way is the closed fixation. We can achieve that with the IMF. In case of a surgical treatment, we should use the IMF before the surgery, and after the surgery, if the occlusion is correct, according to the orthopantomogram, we can remove that. So in every case, we need the fixation technique. In the first picture, you can see my gold standard. We are using that in our clinic. It's the Eric arch bar. You can see that there's an arch bar, and we can fix the arch bar in the periodontal space with steel wires. So it's a little bit harmful for the patient as well and for the periodontal tissues as well. So that's why they started to use the intermaxillary fixation screws. You can see them on the second picture. It's better to use, but we can cause many iatrogenic injuries, for example, by the roots and so on. 10 years ago, they started to use the hybrid technique, especially in the USA. The hybrid technique is an arch bar, and we can fix it with screws, so we can save the periodontal ligaments and the periodontal space as well. My aim is to compare these most commonly used techniques and to reduce the complications and the surgery time. You can see here that my clinical question is there any difference in effectiveness and safety between the currently used methods in treatments of jaw fractures? We have a PICO framework. Our population is adult patients with jaw fractures who need the IMF. Our intervention and comparator are these three techniques, and you can see on the table our outcomes. It could be the application and removal time, the oral hygiene, the glove perforation and needle stick injuries, the iatrogenic injuries, and the cost. And I would like to provide a shorter application time, which is more comfortable for patients and for surgeons as well. We have made our systematic search after the search key was accepted. We have many articles. I would like to show just two of my key articles. I have several. They are mostly randomized control trials, and they use homogenic population. But there are some limitations. For example, the small case number. That's why we would like to make a meta-analysis. And I have one article which compares all the three techniques. We have more than 20,000 searches, so I have made automatic and manual duplication removal with my selection pair Adrien Pal. And we have made a Prospero registration, and now the title abstract selection is ongoing. You can see that my second topic is going to be the maxillofacial injuries related to the e-scooter usage. It's a systematic review and a meta-analysis. The e-scooters are really popular in urban micromobility because they are really cheap, they are highly available, especially in big towns, and they are environmental friendly. But there are no restrictions to use them, for example, in case of alcoholic intoxication, drug abuse, or helmet usage, and we can achieve really high speed with them. And if we fall, we can get some injuries. That's why it's so important for us in maxillofacial surgery. The most common injuries are face and head and neck injuries, especially in case of young, drunk people at night. So that's why we would like to make a meta-analysis from that topic. We would like to use a COCOPOP framework, and our clinical question is that what are the risk factors and what is the prevalence in different maxillofacial injuries in adults related to the e-scooter using. So we would like to see the maxillofacial injuries and risk factors, and our contacts are the e-scooter using, and our population are adult patients. And we would like to highlight the danger and identify the risk factors, especially the intoxication and the helmet usage. You can see here my preliminary search key, and my preliminary search is in 4 databases. And I haven't found any meta-analysis in this topic, and there's no Prospero registration. You can see here some of my key articles. Most of them are from this year or last year, so it's a really fresh topic. And the conditions are the fracture types, the month and season and weekday when it's happening, and the alcoholic or drug influence, and the age and gender as well. You can see here all of my key articles, and we have started the preliminary data extraction. You can see my 2 projects here. I would like to publish them in next year. And I would like to end my presentation with the words of Dan Brown, that everything is possible, the impossible just takes longer. Thank you for your attention.
Congratulations to your presentation. I would like to have a question about your second topic. You mentioned that e-scooter injuries are most common in the head and neck region. Do you know something about what kind of injuries are they? Tooth fracture or bone fracture or just soft tissue injuries?
Thank you for your question. In our department, we can see many of e-scooter injuries and fractures, so that's why I have chosen that topic. And I think here in Budapest, the lower jaw fractures and the nasoorbital ethmoidal fractures and zygomatic fractures are the most common, and naturally the soft tissue injuries, but fractures are more, I think.
I don't want to take the bread from the students, but I have 2 questions. One is, congratulations to your second topic, because I'm really surprised that nobody has taken the initiative to register something like that on Prospero and look into this crazy habit nowadays all over the world. And so my question to this topic goes like, how will you, because most of the studies, I think, will be retrospective cohorts, case series, possibly registries. So what type of studies will you look at?
So they are, thank you for your question. They are retrospective studies and observational studies.
Observational, you mean prospective observational studies?
We can make a prospective one,
no,
so we are planning that, but they are retrospective.
They are retrospective. So how, there must be a kind of a positive selection bias, obviously. So how will you be able to let the public know about the severity of the situation? In other words, the incidence of injuries caused by these scooters. So what I mean, how do we know how many people are using this device and what is the percentage who actually suffers injury? Will you be able to make any estimates in your current opinion?
We would like to make some from the articles, but the articles just mentioned people who had some fractures or injuries.
Yeah.
So that's why we would like to make an own trial from that, and to see that how many person uses that in Hungary, and from that number we can know that what percentage has the injury. But the articles only publicate the injury numbers. Yes.
So I suggest you, when you write up your article eventually, just try to find these companies, the Lime or whatever, and to try to find out what is the population number, what is their estimate. So, just an idea. And my last very short question, who is Eric?
Eric. I don't know exactly.
You mentioned Eric Arch or whatever. Who is Eric?
I think
in a
who
few
has
years'
used
time.
that plate at first, but there's another name of that plate, the Suchard plate. So I don't know who Suchard is.
But in a few years' time, you will develop the Propoci approach, and nobody. Who is Propoci? It's a tool, or Anyway, just a nasty comment. Thank you.